So BHT stands for Behavioral Health Technician. We assist the nurses and the clinical staff in the day-to-day operations.
It's really hard to pinpoint exactly what we do as a behavioral health technician, just because there's so many things day to day that we could do one day that we don't need to do the next day, that kind of thing. Some of those roles include working alongside our nurses and our medical providers, making sure that we're following their treatment plans, ensuring they're getting their medications on time, helping get them to groups on the clinical side of things.
We are the ones that are out there on the floor. We welcome the client when they first show up at the door. We're with them every step of the way, and we're the ones who discharge them when it's time for them to go. And so we really get to see a cool progression of from the time they show up until they leave.
Sandstone Care is different from a lot of treatment centers in several ways. There's the core values that set Sandstone apart. There's also the evidence-based approach to recovery, which is different from a lot of treatment centers. The fact that Sandstone is evidence-based and can adapt to new findings, new medication, new treatment methods sets it apart from a lot of the more traditional 12-step based or less proven and less tested methods.
We work in a field that is so stigmatized and that is so misunderstood, I think, by many people, that by being able to have an attitude of treating everyone like human beings and like they're just more than their addiction, they're more than what they're presenting with. They're people with strengths, they're people with talents, and we try to hone into those kinds of things.
What makes a good BHT, in my opinion, is somebody who shows up every day because they genuinely want to be there. They want to help the clients. They want to serve a community that's so severely underserved.
Patience, compassion, and just being a helpful person. Some people come into the role of a BHT thinking it's going to be like a security guard or an orderly, where you're an enforcer or a narcotics officer. We're not here to bust the clients. We're not here to enforce them. We're not here to subdue them. We're here to help them.
Some things that might make you not a good fit at Sandstone Care as a behavioral health technician is someone who maybe doesn't have experience with de-escalation or crisis intervention. Most of the time, we deal with clients who want to be here and want to get help, but there's other times where crises may arise. There may be things happening on the floor, and having that kind of calm in the storm is really important, and not panicking and being able to perform crisis intervention in that time is, I think, really important.
People that can get worked up easily when little things happen, it happens all the time. And working with live humans is different every single day.
I can think of an instance where we had a client who was struggling with motivation to come back. She was at our outpatient program. She had relapsed recently and was having trouble with getting into the door. I had stayed late my shift that night, and I saw her outside. I was about to walk out the door. I put my stuff down, I walk out to her, and I just start having a conversation with her. She instantly remembered me. After a little bit of time, she made it through that door. That was my last day too before my weekend. So I have my weekend, and then I come back in a few days later, and she's still there, and she thanked me for saying hi to her. And I even heard from other nurses, like, you saying hi to her out there and talking to her in that time before coming in, like she was really relieved to see a familiar face.
Honestly, I have moments that remind me I'm in the right place pretty much daily at work. Clients come in, and maybe it's their first time at detox, maybe it's their 10th time. They come in stressed, they're beating themselves up, they're low. And if I can make them feel comfortable and make them feel like a person, they tell me, and that means a lot to me. It tells me that I'm doing the right thing.
I've had a few aha moments of knowing that Sandstone was the right place for me with not having any kind of formal education background. I'm in recovery myself, and my background does not look good on paper, but Sandstone's not a company that's ever judged me for that. I did experience that elsewhere. After initially getting clean, it was really difficult to find employment, and especially doing something that you want to do. And Sandstone was the place that gave me the opportunity to.